So if I told you that there was a medicine that you could give to a bunch of COVID patients, and for every 20 people you gave it to them, one less would die, would you be interested? I think I would be interested, and that is exactly what the makers of Baricitinib are trying to say in their latest study that just came out a couple days ago. So we're going to kind of talk through some of this. I'll link some of the actual news stories and the actual study itself below, but we're going to talk through the COVE barrier study, which talks about Baricitinib and how it helps ill COVID patients in the hospital be more likely to survive. Okay, so maybe you've never heard of Baricitinib, and I'll be honest, I have never heard of Baricitinib either. It is a arthritis medication that is primarily given out by specialists who deal with that, but not something that I deal with on a day-to-day basis as a family medicine doctor. But there has been a study where they did a double-blind, the best type of study that we have. They did a double-blind study and gave this to a lot of patients in the hospital, 1,500 different patients, and they split it up, and they didn't do anything different beyond the standard of care besides add Baricitinib or add a placebo or essentially a fake nothing pill to it. Now, most of these patients were getting some sort of steroid, which has been the standard of care for hospitalized patients in the hospital. A number of them were getting remdesivir, which is an antiviral medicine, again, which has been standard of care for quite some time. And then they were added into either the placebo group or the Baricitinib group after they'd been kind of stratified by all of their risk factors. Now, there were a couple of exclusions. This was people over 18, so no pediatrics in this, nobody with significant renal failure, nobody who had been through the monoclonal antibody treatment, and nobody who had significant immunodeficiency. So this is, there's a couple of exclusions here. This isn't necessarily applicable necessarily yet to all humans, but a very well-designed, pretty reasonable trial to try and see which patients who were oxygen dependent, not on a vent, but needed oxygen in a hospital, how do we try and keep them from dying? Let's go through the results. So the two main, since really the main thing we're focused on is folks not dying, the two main endpoints we're going to talk about is the 28-day all-cause mortality and the 60-day all-cause mortality. So 28 days in from somebody hits the hospital, they need oxygen, they get put into this trial, they're either started on Baricitinib or this placebo, this kind of fake nothing pill. And when you looked at it, they were at 8% of those who got the Baricitinib treatment died within 28 days. 8%. Now that is a lot and should help you understand that by the time someone is sick enough with COVID to go to the hospital, it is a very, very dangerous situation. 8% of those who got this Baricitinib treatment died, and when they looked at those who didn't get the Baricitinib treatment, that was 13%. So that is an absolute difference of 5%, which does show that if 20 people got this medicine, they ended up saving one life. By the way, this trial shows out at 28 days. So for every 20 people who got this treatment in the hospital, who met the criteria and who already needed oxygen, you actually saved a life for every 20 people you treated. That's pretty great. Now, when you look at the 60-day mortality, each of those numbers went up by 2%. There were another 2%, both in the Baricitinib group and in the placebo group, who died in that next 30 days from day 28 to day 60, right? But the gap between them, that 5% difference still remains. So again, at 60 days, for every 20 people that this trial was treating with Baricitinib, they managed to save a human life. So I think this is something that is really interesting, and I think it would be great to see some more longevity studies on this to see if this extrapolates to larger populations. But I think this is a wonderful thing, and to those who designed this trial, I think you did a pretty good job with it, and I'm optimistic to see if we can manage to save some more people. I do want to throw out there that I think the best way to save people right now, even more than Baricitinib, which is pretty optimistic, good findings, is please go get vaccinated. I know that there are a lot of political opinions and a lot of emotions on all sides of this. COVID is a scary thing, and it's got a lot of people scared, and a lot of people's emotions are really high. But the numbers still show if you get vaccinated, you are significantly less likely to end up in the hospital and need to worry about if you need Baricitinib or not. So please consider it. Try and be safe out there, y'all.